Hi, my name is Jillian Geiger, and today I'm going to be demonstrating an intradermal injection. Before I get started, I am going to verify in the medication room that I have the right client, the right drug, the right dose, the right route, and the right time. I'm going to check against my medication, my orders, and I do have an order for purified protein derivative, 0.1 milliliters intradermal, and it is just one dose. So I am going to get my 1 milliliter syringe that is 28 gauge and half an inch. I know that for intradermal the gauge is going to be between 25 to 28, and the length of the needle should be 1/4 inch to 5/8 of an inch. So this is a needle that can be used. I am going to take in 0.1 milliliters of air. I'm going to remove the cap and inject the air into my container, which I do make sure is the correct drug, and it is. Going to go straight in, pick it up, and draw back. Taking a little bit extra so that way if there's any air, it can be taken out. And now I have exactly 10 milliliters, and I'm going to recap the needle using the scoop method. Wrong way. Using the scoop method, just like this, and set it off to the side. And then I would get the rest of my supplies ready. Also, I do know that I would have gloves on, and I would wipe the top of the insulin container, the medication container, before putting my needle into it, and I would not use the same needle, but for demonstration purposes, I did not wipe the top, put the gloves on, and I will be using the same needle. So I will now go into my patient's room, verify the 5 rights, that it's the right patient, right drug, right dose, right route, and right time. Verify that the patient is not allergic to the drug that I'm about to administer to them. And then I will go ahead and clean the site, starting from the small circle inward and then circling outward. I would discard the wipe in the trash. Would let my patient's skin dry without fanning it or blowing on it or anything like that. I'm going to put my gloves on. Not using sterile technique for this to put these gloves on, just putting them on like normal. And then I will take my needle and remove the cap. Going to just set it back down. Then I'm going to come in. I will move my patient closer. I'm going to come in at a 5 to 15 degree angle with the bevel up. I'm going to twist the safety cap. I would not do this on a real patient, but so that way my bevel can be up. And go in and inject the medication. Holding it for a few seconds and then retracting. I would normally put the safety cap on this needle and discarded it in the sharps container, but for the purposes of this demonstration, I'm just going to scoop the cap back up using the scoop method and closing it. I'm also going to, if there's any leaking of any medication, I'm just going to dab around it without dabbing the site. I do have my bleb. It is difficult to see, but I do have it. And then if it were to be something that needed to be monitored, such as the TB skin test, I could draw a 1-inch circle around it, and I would check my patient after administration to make sure there's no reactions or anything like that. Thank you.